So the lip I'm really careful with because this is the most sensitive part of the body. So I want to just really keep that in mind. How does this feel, Shannon?
Feels fine.
Okay. But I also really want to go after this area because, you know, we get droopy lips as we get older. Notice how my thing's coming off? No big deal. Just re-wrap the tape a little bit. So I just hit this area as best as I can. And she's comfortable. So I get pretty close to the lip. And I really go after those nasolabial folds. So this is not bothering me. We can continue the treatment, but if this is bothering you and you're the one performing the treatment, feel free to turn off the pen, take off your gloves, reapply the tape, and put a new pair of gloves on and start over if you wish. All right, so now we want to go ahead and treat the under eye area the same way we treated the upper eye area. So I'm going to turn the pin way down. I'm going to pull this tissue. Got my little cloth here. So I have some grip. I'm going to pull this tissue and I'm going to work along the bone. If you're not comfortable getting this close to the eye area, don't. But if you would like to get closer, stretch the tissue and pull down. We're just gonna remove the numbing from Van's nose. I'm gonna show you how to do a nose treatment. The reason you would want to microneedle the nose is they say through doing microneedling, am I being too rough?
Yeah, this is a little tender on mine.
All right, I'll be more gentle. They say that microneedling the nose will tighten up pores because it remodels pores. So if you have larger pores, it's a beneficial treatment. Some say it works, some say it doesn't work. You do you, boo. When I do the nose, I do find where the bone begins and the cartilage ends. And from where the bone is upward, like in here for the bunny lines, I can do a 0.3 max. Anything more than that, you're gonna actually stamp the tip of the pen, like it's gonna make an actual mark. Down here, you can go more than like 0.6, 0.8. But the nose is not very pleasant to have done. Some people don't mind it. Some people just don't like it. I always just ask the client what they want. If they want the nose, then we do the nose. If they don't want the nose, we leave it alone. Okay, so to do bunny lines, I'm at 0.3. I'm gonna take this numbing. You don't want to get it into his eyes, so just a little bit. And I lift up. And again, I move the pin around. How's that feel, Van?
Good.
Okay. So again, it's a shallow depth, so you're not going to see a ton of response. It'll be a little bit because I'm bouncing off the bone, but it's not going to be like on the cheeks or inside the cheek. You feeling okay?
Mm-hmm.
So stamp around here, and then I'm just going to turn up a little bit, and I'm going to do more of his nose, and I'm going to find where that the bone begins. I'm going to hold my fingers there, so that way I don't accidentally go over it. And I'm just going to work. How's that feel, Dan?
Fine.
Okay. I'm going to work around. And so you can see he's getting a response. And lastly, on this treatment, we're going to do the chin. It really just depends on how I do the treatment. Sometimes I go in a circle, sometimes I go back and forth. It really just kind of is how it flows. There's no wrong way to do it. How's that feel?
Good.
Okay, so just know as you get into the center, it's going to start hurting more, okay? Because the center, how's that feel?
Fine.
Okay. The center part of the chin, this is the most sensitive area. Notice how she kind of like pulled back a little bit. How you doing?
So
okay. She felt that, so I'm gonna automatically like go a little bit slower. How's that doing, Shannon?
Fine.
Okay. Especially for this crease in here,
yeah,
you can tell
hurts.
them. Can you stretch it with your tongue? Mm-hmm. How does that feel?
Fine.
Okay. Yep, so she's feeling it. So we're done. Okay. So now we're gonna do Shannon's neck. I went ahead and cleaned off the numbing. I'm just gonna anchor her up a little bit. I'm gonna take some of the hyaluronic acid gel, put it all down on her neck. And the same way you do the neck is the same way you do the décolletage if you're doing the décolletage. And I usually start the pin at like a 1.6, and I just keep turning it up till they can feel it. When I get to the esophagus area and the whole hyoid bone and stuff, instead of turning the pin down, I just go lighter. So I'm gonna have you turn your neck to the left there, Shannon. Yep. Okay, so I'm gonna again take a cloth so I can stretch. Remember where your numbing ended. How does that feel, Shannon?
Feels fine.
Okay, so we're just gonna go. Perfect. Now getting in the way.
I felt it a little bit, but it wasn't
okay.
so bad.
Let's see, she felt that. How does that feel?
That feels fine.
Okay. It is harder to get the, so notice I was going fast and I noticed it caught right there. So I'm just gonna slow down. It is harder to get your touches as close together on the neck as it is the face. I think it's partly just because it's a larger area, so I don't know why exactly. But feel free to go over the skin multiple times to get the response you want. And usually I go until the treatment is fully done, or if they're just like, yeah, I feel that, I'm kind of done. Sometimes when people get down to the neck, they're over it at this point. So just go off their comfort level. When I do, I'm gonna push the skin down here. When I do microneedling treatments, I always include the neck. I only charge enough if they want to do their décolleté. I just feel that if you're gonna treat the face, to treat the neck. So I always just include it in the price. See how it caught right there? So I just gotta slow down and have more conscious. So when you get to this point, it's like more of a stamping method, but that's okay. As long as we keep just doing straight down channel and not tearing up the tissues by doing all these circles. Be conscious of the fact that there is a bone here. You feeling that? How you doing?
Good.
Nope, she feels that. How's that feeling?
It just feels weird.
Because it's vibrating it?
Yeah.
Okay.
I don't feel the needle. I just, sorry.
No, you're fine. So we're just going to do this other side here, and then we'll come back to the center at the end. And I'll turn it down a little bit to see if that helps with the vibration. You doing okay?
Mm-hmm.
Okay, so she's starting to feel a little bit more. So, and the numbing's probably kind of going at this point, right? So we're just going to turn it down a little bit because we want our client comfortable. Turn it down a little bit more. Go ahead and anchor, just turn it more. Yep. How you doing?
Good.
Okay. Let me get my cord out of my. I want to move with the client. I don't want to make the client move for me, if that's making sense. Like, I want to wrap around the thyroid well. So you got to be willing to move. Once I'm done with my treatment, I go ahead and pull my cord if I can to separate that out. I do take the tip of my my needles and I put the cap back on. You don't have to, but I do put this back on, and then I put it in a sharps container. I'm going to set it to the side. I'm going to take my aesthetic wipes, and I have 3 left. I'm just going to toss them all in here because I can't reuse them anyway, right? So I'm going to lightly squeeze them out. I'm going to gently wipe Shannon's face down so there's no blood. Now just know if you're using growth factors or PRP or PRF for this treatment as your glide, that you do not remove. Like if we were using that, the treatment would be over and she would just leave. You leave the blood on the face, you don't wipe. It has to sit for 6 to 12 hours, whatever the instructions are from your practitioner. The only time we do removal is when you're using a hyaluronic acid serum. As you can see with this touch and release method, you saw during treatment he had an excellent response, but he is not angry and inflamed and puffy. He's going to have very minimal, considered downtime in his healing process. So we wipe it. I'm going to take the relief gel that we had on the tray. This is what I'm going to use to put a nice thin layer. How's that feel, Shannon?
Feels great.
Yeah, it's super soothing. You can just use plain aloe vera here if you'd like to as well. But I love this product because it has so many peptides and it does have some lab-derived growth factors. And then I go in with the Rescue Balm. I rub it all over my gloves. And then I just take it and I just press it on top. Do you have any questions, love?
What is Aftercare like?
Okay, so for your Aftercare, there's absolutely no makeup today and no makeup tomorrow. Just for the next 2 days, use my heavier face oil. You can,
I have Rescue.
You can use Rescue, you can use Relief Gel. Keep it clean and keep some type of liquid Band-Aid, whether it's oil, Aquaphor Shea Butter, Rescue Balm, over the skin.
Okay.
Not today and not tomorrow, but the next day you can start wearing makeup again. The issue is that you may have some where the blood has coagulated in the channels that we've created, that will then dry and turn brown. So what your downtime is really waiting for the blood to be reabsorbed by the body. The redness is only up for a day or two. Just know though that if you go to put makeup on around day 3 or day 4, after your microneedling, you basically have created so many perforations in the tissues, it's like a postage stamp. So you are gonna get a superficial peel. Your skin is gonna completely kind of flake off, and so it can feel like sandpaper and be textury, and you're gonna hate the way your makeup looks. You can wear eye makeup the whole time. If you wanna wear eye makeup tomorrow, you can. But just know, no base for 2 days, and then after 2 days, you're welcome to wear it. Just know you may not love the way your skin looks for about a week.